Hello, and welcome to Taking Care of Your Body, Session 1, which is all about treatment side effects as part of taking care of your body. We're very privileged today to have two patients and a very profiled pharmacist coming from Halifax today to essentially talk about the side effects, and what happens to your body with colorectal cancer. So I'm going to introduce our two patients first and then move on to our pharmacist. You'll hear from each person individually, and then we're opening it up to a panel discussions. And as always, we welcome questions from our audience. There's a live chat going throughout this session, and we do welcome and are monitoring the chat as well. First, let me introduce Cathy Erickson, who left the corporate world in 2014 and began a new career in fitness with further training and working with stroke survivors and fall prevention. In December of 2019, just before the pandemic, I might add, Cathy was diagnosed with colorectal cancer, and she is now sharing her wellness journey as part of the Kingston Support Group in Colorectal Cancer Canada. Welcome, Cathy. Gary Puppa is an engineer and has been working in the telecommunications equipment industry for over 30 years. In October of 2020, Gary was diagnosed with colon cancer and is currently on active treatment. Thank you for being here, Gary. And finally, Suzanne Zwicker is a pharmacist who has practiced pharmacy in various community settings, from rural pharmacy in small communities to specialty pharmacy, serving patients across the province, and her province is Nova Scotia. She has worked for several years in community pharmacy located within the QE2 Health Science Center in Halifax, where hospital outpatient clinics are served by the pharmacy and are included in the cancer center. In all settings, patient education has always been a large focus of Suzanne's practice. Today, she holds the position of Senior Manager, Clinical Pharmacist on the National Pharmacy Team for Innomar, which is a large specialty pharmacy, where she is involved in building patient teaching resources for pharmacists on a national basis. So welcome to everyone. I'm going to first ask Cathy to introduce herself and to tell us a little bit about your story.
Hello, everyone. My name is Cathy, and I was diagnosed in 2019 with a rare stage 2 T2NO3 anorectal squamous cell carcinoma. It's a tumor. Up until that point, I was a caregiver for my husband, who had stage 4 metastatic prostate cancer, and he was told that he had 5 years to live. At my time of diagnosis, that was 7 years ago. Treatment I was offered included chemo and radiation. I declined the chemo after research, which put me out of the medical oncology loop. It changed my treatment plan for radiation, which included 3 to 4 treatments of the inclusion of adrenals. A surgeon followed me to put me in the medical oncology loop, and he was there. If radiation wasn't successful, then surgery to remove the tumor, as well as leaving me with a colostomy bag. So 33 radiation treatments finished at the end of March 2020, when brain fog started showing up at the end of my treatments, as well as IC, interstitial cystitis. It's a flaring up of tissue. It can occur anywhere in the body, and mine happened to be in the bladder. It feels like a very bad UTI meaning urinary tract infection. So it was tough to complete the radiation treatments, which required a full bladder, and it meant feeling uncomfortable getting to the treatments, and then longer treatment times. Bone pain was getting worse, and I had to learn the hard way to stay on top of that pain before it got too bad, and discussion with my team really helped in that regard. Some of the side effects after finishing the treatments first of all, I thought that once it was finished, I would start to heal and everything would be fine. Well, I found out a month after that radiation keeps on giving. And some of the side effects that I had was the skin dries out, requiring sit spas around the targeted area. Shrinking and scarring can occur, and tightness in the pelvic area. So because of the lack of blood supply and the thinning of the gut, required soft meals and tracking each food item that I ate, as well as bowel recording. So I was monitoring weight loss to go with that. And one of the parts of that daily exercise was to keep track of everything I was doing and when I was doing it. And that proved to be a challenge over time. So staying hydrated for me was one of my biggest issues, because I always felt thirsty. And I would have lots to drink, which was more than what I needed, but it was that feeling of wanting more to stay hydrated. So between diarrhea and constipation, that was a constant challenge for me. I had some gastrointestinal issues, as well as, with the pelvic floor area. I ended up with a physio treatments, and it was exercises, which I found very helpful, but I ended up having leg weakness, first on the left and then the right side. So I had to slow down the physio exercises. I also considered laser treatment for the pelvic area, bringing back the blood supply. But unfortunately, due to my mobility issues, I ended up holding off on that for a while. And so this loss of mobility, building it back up with exercises, bedridden at times, it was a cycle that I was in. And after, I guess, almost not nine months, maybe a little bit longer, after going to my GP, I found out I had 2 fractures in the sacrum on the joints. And so the orthopedic surgeon had suggested that they had these 5 to 6 inches long pieces to put into the sacrum area, but my bone health wouldn't support it at that time. So the issues of ongoing bone pain, it was, difficult at times for me to remember all the tasks in a given day. I had some rectal bleeding, and as the weakness was like a surprise on and off, not knowing when it was going to happen, I ended up staying closer to home, and again, not getting out and enjoying the outdoors really had a part to play in my mental health. I had the prolapse issues, incontinence, and I also had some fecal leakage. So dealing with bone pain, as I mentioned, staying on top of it and talking to my healthcare team was very important for me, as well as the sit spas, which I'm still doing today. With the bleeding, the proctol was used and still is when is needed. So I had an increase in calcium because of the brittle bones, but I had to, in my thinking, increasing calcium with a regular multivitamin wasn't in my best interest because it created kidney stones. So I, had to re-look at that with help. And I increased the vitamin D and vitamin E as well. So I'm still doing pelvic exercises and vaginal exercises, but I'm not building back my core as of yet. I'm back into that cycle of moving about, but not quite to the full extent that I had been when I started the exercises. So it's been an ongoing challenge, but I can see that there's a light at the end of the tunnel, and I'm pleased to be able to share this, because I think this is part of my healing journey as well, is to share what I've gone through, and I felt like I was in the dark for a big piece of it. So thank you for the opportunity.
Thank you, Cathy, for sharing in very significant detail the side effects you've had. But what I also like very much about what you said is the number of things that you tried along the way. And we'll have another discussion about that once we loop Suzanne back into the conversation as well. So I'm going to ask Gary to share his story, and then we'll go to Suzanne.
Thank you for the introduction. I would also like to thank Colorectal Cancer Canada for inviting me to this panel discussion and for their support during my treatments. An overview of my story: in the summer of 2020, I had very mild digestive tract symptoms that led to me having some blood tests done, colonoscopy, and eventually a CT scan. In October 2020, I was diagnosed with stage 4 colon cancer with metastases to the liver. I had a PICC line implanted in my right bicep muscle and was put on 8 weeks of FOLFOX chemotherapy treatments in order to shrink the tumors. Starting in February of 2021, I had a number of surgeries. First was a colon resection, then a liver wedge resection, a liver portal and drainage vein embolization, and finally the big one, a liver resection where they removed 2/3 of my liver. When I left the hospital, I was tumor-free, which is great. All the surgeries went very well. And over the next few months, the liver grew back, but so did new liver tumors, which was actually devastating news. So I had to go back on chemo. So they put a portacath implant in my chest, which you might be able to see under the shirt here, for the chemo line. And I was put on FOLFIRI with Avastin chemotherapy. I'm still on FOLFIRI, and I've had over 17 treatments over the last 9 months. And I'm happy to say that the chemo is working and the tumors are shrinking. All of these chemotherapies and surgeries have both physical and mental side effects. And just because the side effects are listed on the medication, it does not mean that you will experience all of them. I think every patient has their own unique reaction to these medicines, and every patient has their own story. What I found is it's important to be prepared and to know whether a side effect can be treated with something from the drugstore, a doctor prescribed medicine, or in the worst case, if you need to go to the hospital for a particular side effect. Do phone your cancer center and be talking to them along with the nurses in the chemotherapy unit, as well as with your oncologist. Often they can make adjustments in the chemotherapy treatment to reduce the impact of the side effects. I also strongly recommend joining cancer support groups like the ones offered by Colorectal Cancer Canada. And these support groups are a great place to discuss side effects with other people who are going through the same treatments. Finally, one last thing, I highly recommend everybody go for a walk every day. Even if it's 10 minutes, go for a walk. I found it helped me with my recovery from surgeries very much, and surprisingly, it does seem to lessen the side effects of chemo, especially during chemo weeks. So if you can do 10 minutes a day, that's perfect. If longer, even better. Thank you.
Thank you so much, Gary, for sharing that. There's so much research now on walking as beneficial on many, many, many levels. I'm going to ask now, Suzanne, for you to give an overview of general side effects that, particularly both in radiation and chemotherapy, that you see, given the number of folks that you interact with on a day-to-day basis. So a quick overview, help us understand if Cathy and Gary's stories are common, and then we'll get into a general discussion.
Hi, welcome everyone, and thank you for inviting me to this session, and thank you to both our patients there for sharing their stories. I think, to Gary's point, I think the important thing with side effects to realize is that they are a list based on medical evidence, clinical trials, etc. But to your point, Gary, not everyone experiences every side effect, and not everyone experiences them in the same way. It's your medical history, your comorbidities, your quality of life, and your life in itself, all play into what you experience when you go on medications. And it's very much, again, to your point, it's not just physical, it's emotional and mental as well. And being informed and aware can sometimes allow you to put some pieces in place to just have a strategy or some tools in the toolbox to to help you moving forward. So I picked just a few sort of common side effects and thought I would just sort of summarize some things here. One of the very common side effects, of course, diarrhea. And when you're tracking and you have a journal, it's a good idea to make notes of what you're feeling, when you're feeling them, what happened when the side effect occurred, that sort of thing. Just in the big picture, when you go back over a few weeks, it's hard to remember details. And sometimes you can, if you have a journal and these things, documented, it helps to have things in the proper perspective. So I guess back to the side effect of diarrhea. So when did it begin? What was it like? What are you, what were you eating? What are you managing to keep in? Did you make any dietary changes? Is your fluid level okay? I mean, if you do have the side effect of diarrhea, it's important to make sure that your fluid intake is good. That you can make changes to your diet. There are recommendations, many patient resources where you can find things that you can work with your diet to make the impact of that side effect less. There are certain things that you should avoid, things like caffeine. Sorbitol, for example, artificial sweetener has a laxative effect. To the skincare point, a sitz bath, very good idea for soothing the skin and protecting it. Treat the skin gently. Use soft towels, patting, use zinc oxide ointments to protect the skin. And of course, there are medications that you can get to help with diarrhea as well. Discuss with your cancer care team when you should seek extra help. If you're fevered, if there's blood, if you have signs of dehydration, if your urine is dark, if you're feeling dizzy, or just confused. So another side effect that people find really troublesome, of course, is nausea and vomiting. And many of the medications that we use do tend to cause nausea and vomiting. There's usually, depending on the treatment that you're on, the level of nausea, vomiting side effect is sort of categorized, and there are medications that are given to help with that. The timing of those medications is very important. So you'll be giving a schedule of to take before your treatment, during your treatment, and afterwards, or on an as-needed basis. So very important to follow those instructions. Just so that you're maximizing the benefit of the anti-nausea medication. When to seek help if you're really not keeping anything down, if you're showing signs of dehydration, if you're vomiting like coffee grounds, those sort of things, very severe symptoms. There are things, again, that you can do with your diet that help with nausea. the temperature of the food, consistency of the food, if it's spicy, heavy, fatty, that kind of things that you can change. And also sometimes odors, not being around when food is being prepared, the odor itself can cause nausea. Putting lids on cups so that you're tasting and not smelling. Those are little tips on how to manage that. One of the biggest side effects that cancer patients experience is fatigue. And it can be for a multitude of reasons, due to radiation. It can be due to the medication. It can be due to the emotional and mental impact of the condition. So it's important to sort of keep track of that. It's important to pace yourself. It's important to not overwhelm your day, to do things that you want to do when you have the most energy. Really keep an eye on that. To keep an eye on your sleep hygiene. Are you sleeping well enough? Are there things that you can do to get a better quality sleep? That sort of thing. Again, it's important to sort of track it and bring it up with your doctor. Because it can be caused by many different things. And although blood work is monitored regularly, to watch for things that may be contributing to the fatigue, it is important to mention if you've noticed a change. Something that patients often experience is mouth sores. There are things that you can do to help with that. There are recipes that you can get for oral rinses. It's important to watch your dental hygiene when you're going through treatments. Sometimes using a softer toothbrush will help. Important to avoid things like alcohol-based mouthwashes that can, make things worse. It's if you wear dentures, important to practice the hygiene care on the dentures, and to report anything to your doctor, especially if there's a fever involved or a foul odor, pain, bleeding in the mouth region. Again, there are dietary things that you can do to help, soft foods, or adding more liquid to the meal, that sort of thing. Skincare is very important when you're going through cancer treatment. Many of the medications do have side effects, rash, hand and foot syndrome that are caused by the medications. But in general, going into it, it's important to practice good skincare, and make sure that you're moisturizing, morning and night, that when you're bathing, that you don't use water that's too hot, that can contribute to the dryness, that you wear comfortable clothing. If your skin's irritated, make sure that you're wearing fabrics that breathe and that are comfortable and not irritating it. And things like tight waistbands and that sort of thing that can chafe and annoy the skin are things that you can do. And of course, always make sure that your nutrition is well balanced for your skin and that you're hydrated and that you're wearing sunscreen. Some patients find the side effect of hair loss or side effects that affect the hair, like brittleness, dullness, those kinds of things, particularly bothersome. And you can prepare for those by, looking at head coverings or wigs, finding out where your resources are there to help with those things. Your appearance can often play into how you feel about yourself and your mental health. So important to prepare for that. Usually, it's only during the treatment that it happens, and it does come back. So it's it's just a sort of bump in the road to get through. part of the journey, and but being prepared sometimes helps you to deal with these things as they happen. Nerve and neuropathy is another thing that can happen during treatment, and that can manifest in different ways with numbness or pain or an exaggerated feeling to a minor stimulus. It's called allodynia. So these things are important to keep an eye on from a perspective of making sure that you don't injure yourself because of skin numbness, making sure that it's not contributing to a falls risk, and also making sure that it's not being caused by something else. Like we always also have a comorbidity of diabetes, making sure that your blood sugar levels are okay, in talking to your doctor about it. It's important to put things in place to protect yourself. When you have numbness, it's important to look at good footwear where you don't want skin breakdown to result because you don't have proper feeling in the feet. So always sort of checking inside the shoe before you put them on, and wearing again clothing that doesn't cause irritation or further damage. Many side effects can be detected by going for your regular blood work and follow-ups with your doctor. So, very important to keep all of those appointments. You can monitor things like your blood pressure at home, just to make sure that you're keeping track of that and learning how to do that properly, making sure your cuff fits right, and making sure that you're monitoring the blood pressure, both feet on the floor, arm it's sort of chest length on the table, relaxed, that you're relaxed, that you haven't had a hot drink in the last few minutes, those kind of things. Finding out the best way to take your blood pressure at home and recording it maybe twice a day, just as something that you can have in your journal. And also your weight, monitoring your weight so that you'll be able to detect if there's a sudden change in your weight. And in general, just looking after, your general health, and protecting against the risk of comorbidities, especially down the line following treatment and that sort of thing. So immunotherapy side effects can sometimes be delayed. So always keeping that in mind, even after treatment, as you're in a sense, the busy part of your treatment journey starts to draw down. Just always monitoring your health going forward.
Suzanne, thank you so much for what is a deeply comprehensive overview on some of the side effects. And what I like very much about what you've talked about, some of these are just what I call general health, lifestyle, day to day. Gary, Cathy, did you have the kind of fulsome information that Suzanne shared with us now going into your treatments? Were you aware of some of the side effects you might experience outside of what I call some of the obvious?
I would say what happens is when you first start, in my case on chemotherapy, you're given a bunch of literature from the drug manufacturers, or with all of the different side effects, and it's a bit overwhelming to read through all of that, and it's really hard to kind of. Initially, you think you're going to suffer from all of those things, so it's a bit hard to kind of absorb it all. And I think it just takes time, and it took sort of a while to kind of understand things. And I started keeping a diary, like Suzanne recommended, my blood pressure, my weight, and also if I did have a side effect, when did it start? Like initially, I was on 2-week chemo cycles, so when did I experience it? Was it on chemo day 1 and so forth? And how severe was it? Because in some cases, the side effect's fairly minor and it's not a concern. In other cases, the side effect, if it's severe enough, then it'll trigger an action for the doctor to do. So that was, the diary is a great idea. The diet, for me, I modify my diet a few days before chemo session, just so that my body is prepared. So, for example, I won't eat foods that cause constipation, like cheese pizza. I'll avoid spicy foods because that'll cause mouth sores. I'll do a full dose Restorelax for that week, but then I'll cut down to half. So there's sort of, I think it's important to keep track of these things through a journal, and also to figure out what works for each person, because it is different. And then just one last thing on the sleep. She mentioned sleep. Sleep is extremely important for the body in its healing process. And often I wasn't sure if I wasn't sleeping well, if it was due to or if I was fatigued. I wasn't sure if it was due to the chemo or was it due to me just having a bad night's sleep. So I purchased an Oura ring to help monitor my sleep pattern. And that went a long way to forcing me to go to bed earlier, and things like that. So I think, there's lots of good information out there, and sort of figuring out what works for each person is kind of important, because what worked for me may not work for the next person, but I think it's good just to have a lot of information. It'll take time to go through it.
Yeah, and I want to come back to that point, but first I'd like to hear, Cathy, did you have the kind of fulsomeness of understanding of what you might experience going into your treatments?
No, actually I didn't. And what I hear is it's nice to have that information written down somewhere. I agree with Gary. We get pamphlets on diarrhea and a few things like that. But in terms of the heat, and how it affects the skin, what clothes to wear, just things like that would be really helpful. So I think they could expand on some of that material, or a link somewhere where we can look at that information when we can absorb it. Because that's the other piece. How much information can we take in at any given time? So it's two things that come to mind. You can absorb so much information, but the other piece is that things are happening with your body, tracking. There are ways to do it other than writing, find that out. So there are apps free that will provide a tool for you to collect that information, and that's going to be very helpful.
Is there an app that I know you are. I know. Is there an app, Cathy, that you liked that you think would be helpful to the folks listening?
I went to.
If you don't have it right now, that's fine. We're happy to share it with everybody afterwards. I wanted to bridge back to you, Suzanne, is to understand what I call the role of the pharmacist. I'm going to guess that it's not always obvious to a patient with cancer that a pharmacist can be an amazing resource to them, both at the specialty level as well as the community level. And so if you could just speak a little bit more about the value of a pharmacist, the service they can provide to cancer patients, especially on a more regular basis when perhaps it's not as easy to get in to see an oncologist or your doctor.
I think that, just to your discussion, we can be used as a resource. I think that sometimes just talking through, and I find, both Cathy and Gary mentioned, at the time you're just overwhelmed with information. And I know in the past, and something I really try to guard against being is the information dump truck. You want to have it in more context. And I think for me, having a patient come back and say, this is happening and this is happening. And I was thinking that perhaps, this may be causing it, or that may be causing it, or what do you think about me trying this? And I see that as my role, where I can look at your medical history, the medications that you're on, the medications that you've been on, and the medications that you're currently using for treatment, and just sort of help you through that process in making a decision in what would be best. And so that's how I see my role, and I always hope that patients in the community see us in that role as well.
Mm-hmm. Mm-hmm.
And Maria, if I could add one thing.
Yes, of course.
The pharmacist. So the hospital that I go to, they have this system called My Charts, where it's a patient portal. I go into that portal and I enter in, all my medicines are there, but I also enter in all of my supplements and vitamins that I take. And when I started this current chemo treatment plan, the pharmacist from the chemotherapy unit came over to visit me, and he said, you got to stop taking the supplement. And I said, why? He goes, it'll interfere with your chemotherapy. So often I think people forget that piece, that they really should let the pharmacist know everything that they're taking, supplements, vitamins, everything, because there are interactions between some supplements in terms of they actually reduce the impact of chemo. So it's very important.
Mm-hmm, mm-hmm, mm-hmm. Suzanne, I'm sure you may want to comment on that, but I would also suggest that outside of drug interactions, just basic things like you had recommended inserts for your shoe, Suzanne, or sunscreen. Some of what I call the things that you would just normally buy in a drugstore can help relieve some of these side effects in very simplistic ways.
Yes, and to Gary's point, definitely part of when we have a new patient that comes on board, we collect everything, try and get. We do have access now to provincial records that show your current treatments and your treatment history to a certain extent, but we always collect that information as well, and including complementary medicines. And we'd like to go beyond even the drugs and the herbals and the vitamins and that sort of thing, and looking at are you currently having other treatments done, like physiotherapy, or are you seeing an occupational therapist, those kind of things, just so that we have a good picture of all the treatment strategies that you're currently using. And yeah, it's sometimes it's just a little hint. And I find patients sometimes when you're working in a community pharmacy, another patient will provide a really great solution that we can then share, and it's just part of the collective voice. So yeah, this type of forum is excellent for that. Yeah.
Good. Thank you so much. We only have a couple of seconds left, but I wanted to close this session before we go to Q&A and ask just for what's the one tip each of you could provide in terms of managing mental health side effects? The idea that we talk a lot about the physical part of this, perhaps not enough about the mental side effects. What's the one thing that each of you would like to say to our audience about the management of a mental side effect? Cathy, I'll ask you first.
Thank you. I think the biggest thing that I found is it was a lonely journey. And consequently, connecting with Colorectal Canada was a big step for me, as well as Wellspring. So the combination of those two helped me out of the funk and move forward. So I'm deeply grateful for both organizations to be there and the support that they provided.
Thank you so much. Gary?
Echoing what Cathy said, I think when I started my chemo journey or my cancer journey, I figured I could do it all by myself, right? I was strong enough, I can do this. And at a certain point, I realized that I couldn't, and I joined one of the colorectal cancer Canadian Colorectal Cancer support groups. And now I was talking with other people who've gone through the same things that I'm going through. Made a huge difference. Being able to interact with other patients and other people who are either starting their journey the same place I was, or they were actually a couple of years ahead of me. So it makes a huge difference to people, and I strongly encourage people join a support group that works for them.
Yeah, thank you. And your point about walks is well taken. And Suzanne, you have the final word.
Yeah, I agree with the walking. I can't say enough about walking and being outside and just letting all your senses experience everything. It does a world of good. I really think mental health, it's important when you're taking so many physical notes to pay attention to your mental health and how you're feeling, and realize that when you're going through a big diagnosis like colorectal cancer, that it has an emotional impact, and tracking everything and tracking your mental health is important. So if you've been feeling, you're going to feel sad, you're going to go through the grief of a diagnosis, but it's when that's extending and you find that you're not able to cope, that's something that you bring forward to your healthcare professionals. It's just as important on the treatment journey.
Yeah, agreed, 100%. Thank you, Cathy. Thank you, Gary. Thank you, Suzanne, for a beautiful panel.
Thank you.
Thank you.
Thank you.
Great, and we are now here for about a 10-minute question and answer session. During this session, there was dozens of amazing questions that have come in. And Suzanne, the first question I want to send your way, and I'm going to read it out loud to you. I was told not to take anything, vitamins, herb supplements, during chemo and radiation. I also hear that some herbs do not work well with these types of treatments, but I'm not sure why. Now that my treatments are over and I am again taking supplements under the guidance of a doctor and naturopath, I wonder if the pharmacist could comment on that. Suzanne? Chad, I think Suzanne is on mute. Oh, we've had some issues here. Oh, I think she's having trouble getting on. Okay, maybe I'll go to another question. Gary, Cathy, you can hear me all right. Oops, we've lost Suzanne. All right, let me go on to another question. Let me find one here that one of it coming in is someone has actually gained 30 pounds during a session of oxaliptation. Pardon me, I've just tripped all over that. And now considered obese with high cholesterol. Why the weight gain? Did either of you gain weight? Is there any considerations or thoughts that you could offer around this?
So I was on full Fox, which has the, I'll call it oxy, the bad oxy, not the good oxy.
Thank you for helping me with that. Yeah.
Yeah, it was a bit of a tongue twister. I didn't gain weight because of that. If anything, I tended to eat less. So, but like I've said before, I found with these, especially with the chemotherapy drugs, the impact on each person is totally unique. So it could just be that the particular interaction with that person's biology had that impact. That would be my only
Yes.
thought. While we're waiting for Suzanne to come back, I did have I could talk a bit about the interaction with supplements on chemo and why maybe that person was told not to. In my example, I was taking turmeric, and turmeric is great because it protects the cell from damage. Unfortunately, turmeric also protects cancer cells from the chemotherapy. So that's the reason my pharmacist told me not to take turmeric while I was on chemo, because it was protecting the cancer cells from the chemotherapy, which is what we don't want. So I had to stop taking the turmeric. But the other supplements, the other supplements and vitamins were green lighted by the pharmacist, having no interaction with the particular chemotherapy that I was taking. So again, it depends on the medicines that you're being prescribed by the doctor, and the pharmacist is the one who will understand those interactions.
Thank you, Gary, for that. And welcome back, Suzanne. We missed you, especially for a very important question. No worries at all. Here you are now. Is that a question you feel comfortable answering at this stage? It's really just about the vitamin supplements that one takes post-chemo,
Yes,
post-treatment.
it's always best to check in with us, just to make sure that, you know, and we'll be looking at everything, you know, your cancer treatment and your other medications that you're on, just to make sure that nothing that you take will affect that in an adverse way. And sometimes it's very much a moving subject. You know, there's new research coming out all the time, and it is definitely its own area of study. But with the evidence that's available at that time, we can certainly help you make the best decision for you and, you know, your health condition and the other medications that you're on.
Mm-hmm. Thank you for saying that. I'm going to move to another question. The question here is, I have neuropathy very badly for over a year now, and since my last treatment. I've heard that castor oil is good for neuropathy. Is this correct? So, Suzanne, maybe I can ask you to provide the pharmacist's opinion on that. And then maybe, Cathy, if you've had any experiences with it.
It's not something that I've come across in reading as far as being beneficial. Certainly something with the question that I'd like to investigate. You know, every question is a valid question, and sometimes when a patient comes with a question such as that, it's, you know, it's intriguing, and it's something that, you know, I delve into a bit deeper. So I'm sorry, I don't really have an answer for you right now. Not something that I've read about, but definitely something I will be investigating.
Great. Well, thank you so much. And I think that's a great way for us to park that question. I know that the amazing team at CCC will be in connection with you, and we can get an answer to that question for somebody. In the meantime, let me move on to another one here. Is there any symptoms to watch out for if we have an ileostomy during heat waves? Is that a question that?
Yeah, I think the key thing with an ileostomy is watching for signs of dehydration. So, you know, checking that your urine output is good, that the color of your urine, you know, signs of dehydration. How's your skin? How's your mouth? Is your mouth very dry? You know, just being ever more cautious around the signs of dehydration.
Great. I think this is a great bridge right into the next question, which is, are there any brands of moisturizers or mouthwash that, as a pharmacist, you might recommend in these circumstances?
There's a few different things out there, and I mean, with moisturizers, you need to really focus on the best type for the job. Lubriderm Glaxol base for a general moisturizer. Looking at things that are unscented. You know, when you're looking at feet treatment and the coarser skin on the feet, you might use a different moisturizer. Knowing which moisturizers would be more irritating on different areas of the body as well. Definitely something to get advice on, and something to be cautious with. When you've got irritated skin, you want to be sure not to add, fragrances or that type of thing that could, further the problem.
Great, great. And just in the couple of seconds that we have left, Gary or Cathy, is there any advice that you wanted to offer around moisturization specifically that would be helpful to the audience, given that it is such a key subject?
Yes, I found that I had to go through a variety of moisturizers to find the right one for me, and I stuck to Pond's. And for the area in question, it was the sitz baths and airing out that worked, and then the Lubriderm afterwards. But one of the things that I've been taking that seems to be working for me internally and externally is a little bit of olive oil every day, and it somehow is helping me. The skin is starting to feel better. And you can put it topically or ingest it. I mean, either, but I'm taking it every day, and that seems to be helping me.
What a lovely, simple piece of advice. And Gary, just a couple of seconds, any final comments?
On the moisturizer, so this was, I'm a man, I've never used moisturizers my entire life. So then as soon as I started going on chemotherapy, then I noticed my my feet would get dry, my fingers would get dry, my fingertips, all side effects of the chemo. So I'm starting to learn a lot about moisturizers. So I'm still learning, but they do help. So I highly recommend.
Good. We'll get you for the next session. We'll give you a whole session on moisturizing for men. How about that? With that note, again, thank you so much, Cathy, Gary, and Suzanne, for being with us today.